Hello doctors, welcome to We Medico's channel. I'm Dr. Deepika. Today we are going to discuss drug overdoses in the Plab1 clinchers. Paracetamol overdose. You have the symptoms of vomiting, right upper quadrant pain, jaundice, liver failure. Coming to the treatment option, if the patient presents, if within less than 1 hour, give activated charcoal, or if you can measure the 4 hours plasma level, if it is more than the treatment line, or maybe if it is staggered dose, which means this dose is not taken at one time at different levels. And if the patient also some of the criteria, like if the patient presents more than 8 hours, and if they don't know the timing, you need to give IV N-acetylcysteine. I also suggest to go through other criteria when to give N-acetylcysteine in paracetamol poisoning, which I will be discussing in another video. Aspirin overdose, vomiting, hyperventilation, tinnitus, vertigo. Initially, it presents with a respiratory alkalosis. Later, it turns to be metabolic acidosis. And one more important thing, like you can remember aspirin, so ring in the end. So which means like ringing sensation in the ear. So tinnitus, in that way you can easily recognize in the exam. And if the treatment options, if presence less than 1 hour, give activated charcoal, similar to the paracetamol. And it's metabolic acidosis, so do the alkalization of the urine. And if the aspirate levels are more than 700, then go for the dialysis. Opioid overdose. So in this, just remember the drug addict, how he looks like, everything drowsy kind of. So everything will be low. Low respiratory rate, low BP, low heart rate. And just remember the 2 O's in the opioid. So think of like meiosis, and also like 2 O's in the treatment as well, like IV naloxone. Phosphate overdose. So when you think of the OP, just obviously the one thought that comes into the mind is suicide, like always crying. So increased lacrimination. So you can think of just remember the pneumonic sludge, increased salivation, lacrimination, urination, and then diarrhea. These are all seen in case of the OP overdose. Tricyclic antidepressant, amitriptyline overdose. It's an important one because it leads to metabolic acidosis, and in turn leads to ECG changes like widened QRS and then broad complex tachycardia. Just remember it's like tricyclic antidepressant, T. All the symptoms starts with D, like dilated pupils, dry mouth, dry flushed skin, drowsiness, and decreased BP. Also others like tachycardia and then urinary retention. Just remember, we always confuse with is it constriction or dilation. So it's a depressant, D for dilated pupils, mydriasis, and it's also D in it. So coming to treatment options, if patient is in severe metabolic acidosis, give 250 ml of 0.9% of normal saline. And in the exam, it's important to remember the percentage. It is 8.4 percentage of sodium bicarb, 50 millimoles IV slowly. Please remember 8.4% of sodium bicarb. Cocaine overdose. Remember, complications are important. It leads to acute MI, intracranial hemorrhage, seizures, aortic dissection. And cocaine leads to everything is high, everything is elevated, like high BP, high heart rate, high respiratory rate. And it leads to dilatation, mydriasis. Just remember mydriasis, it's an important, we confuse in the exam. perforated nasal septum, and then hyperthermia, decrease in weight, and then restlessness. These are the other symptoms. ECSTASY. People present with tachycardia, tachypnea, thirst, hyperthermia, metabolic acidosis, spurts of colors, like flashes of colors, and agitation, uncontrolled body movements, muscle rigidity. For treatment, we give supportive like airway, breathing, circulation, and treat metabolic acidosis. For agitation, we give IV lorazepam, diazepam, and if that hyperthermia is not controlled by the symptomatic treatment, we go for dantrolene. So if you struggle to remember for the ECSTASY, you can just see from the name. Remember, like we use anti-epileptic drugs for agitation, like lorazepam, diazepam. C is like colors, spots of colors or flashes of colors, and T for tachycardia, tachypnea, thirst, and A for like remember acidosis, metabolic acidosis. Thank you guys for watching this video. If you'd like to see more videos like this, please like and subscribe, and let me know in the comments if you would like to discuss any specific topic. And thanks for watching again. This is your Dr. Deepika.